So Thabiso was a rescue lab, and we adopted him when he was 3.5. And he had so many health issues over the years. He had developed a neurological disease, and it greatly impacted his hind limbs. So he was at a neuro recheck appointment, and the neuro said, he's limping a little on his front leg, and it was barely noticeable. Like, honestly, I only believed him because he has more experience than me. Like, I couldn't even detect the limp. It was that slight. This was on a Wednesday. By the weekend, he was barely weight bearing. And the neuro had just assumed, oh, it's a progression of the neuro disease. Didn't even, wasn't even on the radar to do any further testing or anything else. And by the weekend, when he was so bad, the Monday he had an appointment with his acupuncture vet, and she's certified in rehab as well. And so she did a thorough exam, and it became clearly obvious that his pain was coming from his proximal humerus. And I suspected already, because of how rapid the change was, I suspected it was bone cancer. And of course, she didn't say anything. And I said, are you going to tell me? And she said, what if I don't want to? She said, I really don't want to. And I said, well, I think I already know what you're going to say, so just spit it out. And she did. She said, you need to get him seen immediately somewhere. At his size, with his neuro disease, we just can't let this progress. And so the best option for us was to call back his neuro doctor, neuro specialist, and begged and pleaded with him to get Thabiso in for an x-ray. And he was like, why are you calling me for this? And we said, because I know you can get it done right away. And he graciously agreed, even though it was not his thing at all, really. So the following day, on Tuesday, I brought him to the neuro specialist. He had the x-rays. They have a board certified radiologist who looked at that and looked at the MRI. He had 6 to 8 weeks, I don't remember the exact date, prior, at another facility, because we weren't able to do the testing there, and gave us the grim news that the x-rays clearly indicated osteosarcoma, as did the prior MRI. So sadly, had we known, we could have alleviated all of the pain, because we would have already started treatment prior. But that neurologist chose not to send imaging out for a board certified radiologist. So we learned a tough lesson that day about always having images reviewed by a board certified radiologist. And from that point forward, any image we've ever had of any dog always goes to a board certified radiologist now. And it was explained to us that a board certified radiologist often has no clue what even the dog is there for. They look at the complete picture. They look at every single speck of the image and find anything that's on there, whether it's what you were initially looking for or not. And that's the reason, to have them do it. They would have seen the tumor back then. The neurologist who reviewed the MRI didn't, because it was not what we were focused on. We were looking at his spine and his hind limbs. He was not looking at his forelimb. So there was no reason for him to look there and see it. And it was small, but it was shown to me and, clearly there. So that was a lesson learned. And because of the neuro disease, that was why amputation and surgery was off the table. The neurologist's recommendation to us was, he's already limping so badly, you could try slinging his leg up and seeing if he could manage on 3 legs. He said, I doubt he's going to be able to, but you can try it. And we tried, and he could not manage at all with 3 legs. He remained barely weight bearing, only because he had no choice. He couldn't not use the leg like some dogs you see. He had to put some weight on it, but I have video of him, and it's pretty atrocious how extreme the pain was. So we started doing research right away. The neurologist laid out all the options. He didn't lay out any options of clinical trials at that point, but he told us about palliative radiation. He told us about medical management. He told us about amputation. He told us about stereotactic radiation, chemo, all of the different options. For a neurologist, he was very knowledgeable in that regard as well. And just in talking with him, and then coming home and calling our regular vet, who was amazing through everything Thabiso went through, as well as our acupuncture vet, we all were in agreement that probably our best bet for him is going to be radiation of some form, be it palliative or stereotactic. Is going to depend on what we can find and, what they see when they do more imaging. So the next step then was find an oncologist. And, I just started researching, pulled pull up the site to, look for oncologists. The closest oncologist to us was 2 hours minimum away. We're in upstate New York. We now have one that's an hour away, but at the time of Thabiso's diagnosis, the closest one was 2 hours away. And started calling them for appointments and also researching stereotactic radiation because Thabiso had been, despite all his health issues, had been doing fantastic up to that point. So we wanted to give him the best chance of extending his life with good quality. So he had turned 11 in May of that year and he was diagnosed in August. I also was researching facilities that had stereotactic radiation. The closest one of those was 4.5 hours away, and it happened to be the CyberKnife Center in Malvern, Pennsylvania, and called there, as well as calling around to other oncologists. We did not get an appointment there, but Julie, the person you speak with there, was amazing in sharing information with us. And so we already had a contact there. We ended up going to, it was at that time Veterinary Cancer Center in Norwalk, Connecticut. We knew at that point we wanted to pursue radiation, and they had a radiation oncologist on staff, but they could only do palliative radiation. So we were able to set up our initial appointment with the radiation oncologist versus the medical oncologist. So he was diagnosed on a Tuesday. On Thursday, we had the appointment scheduled. On Friday, the radiation oncologist called us to get more information, and our appointment was on the Monday. And he already, over the weekend, had ironically been in touch with the CyberKnife Center. Dr. Haney there was his mentor. So he had called her about Thabiso's case. And then when we got to the appointment, we did the CT scan. They found what they said were 3 questionable spots on his lungs, which turned out they did not think they were anything, and turned out they were not, and found that the tumor was both bone producing and bone destructive. And the amount of lysis in the bone was such that he was a good candidate for stereotactic radiation, fortunately for us. If it had been extremely lytic, then the radiation would have probably fractured the bone. So we were lucky we were able to proceed. He did the first zoledronate infusion at that appointment. And while Thabiso was having that, he was setting up his appointment with Dr. Haney at the CyberKnife Center for us. So that was a Monday. And then on Thursday, we had our consult by phone with Dr. Haney. Again, tons of information. The following Monday, we left at 4 a.m. to get down there, had his CT done for the 3D imaging, met with Dr. Haney, and stayed overnight. The following day, he had his stereotactic radiation delivered all in one fraction. Not typical, but because of our travel time and everything, she did it that way. By 36 hours after we got home, he was already improving. And over every day after, for 2 to 3 weeks, he continued to improve until he had no limp whatsoever. We got him off the pain meds completely. He never, ever limped on that leg again. He just did amazing on that particular leg. We then followed up with chemo. And at that point, our goal had always been to do the listeria vaccine clinical trial. I had not heard of the Yale clinical trial at that point in time. We proceeded with the chemo. And at the end of chemo, when it came time for figuring out whether he was eligible for the listeria vaccine, it turned out that because of the steroids he was on for his neuro disease, he was ineligible. In hindsight, I'm glad it worked out that way. What happened was we continued with our zoledronate and every 3-month x-rays. And maybe about a month after that, I saw a post on one of the bone cancer groups, somebody about the Yale vaccine. And it just happened. It was Mike Rossi. He was going to Norwalk as well. And it just happened that we had been sitting next to him for our appointment. I didn't know it was him. We had conversed in the group, but we didn't realize we were at the same location or anything like that. And when I got home, he had posted about the happy news about his dog. So I right away contacted him and I said, I recognize that dog. We were sitting next to you. And so he gave me the information. And so then I called back about, is Thabiso eligible for this? And initially we were told no because of the steroids again. I ended up contacting Mark, Dr. Mamula. He said, yes, Thabiso is eligible. At that point, Dr. Ettinger had left. Our medical oncologist had been changed over to Dr. Post. Post. So, we told Dr. Post, hey, you're part of this. We want this. And so we were all set up to do that. And then Thabiso, with his major medical issues, ended up getting, we didn't know what it was at the time. It ended up, eventually we realized he ended up with a nail bed infection, almost lost his toe and his foot because the infection was so bad. So we were dealing with that. They had to culture it. He was on, it took, I don't know how long. And initially we didn't think it was a nail bed infection because the x-ray showed a foreign body in the toe. And so it looked like a small needle in his toe. It was metallic. And so that was the thought of what was causing all the issues. A surgeon determined that there would be, it literally was looking for a needle in a haystack. He could not operate. So all we could do was try to fight the infection and hope that whatever the object was worked its way out. Well, it ended up that the object was just one of those red herrings that had, nothing to do with it. It took about 2.5 months, 2.5 to 3 months to resolve the infection. And so it was April before he actually got the first vaccine. Every 3-month x-rays, no issues. Yeah, no limping, no nothing. And he did not produce antibodies on the first blood samples. It wasn't until the final blood sample at, I believe it was 8 weeks, that he produced antibodies. So again, as Mark said, Thabiso was unique in just about everything he did. And so he was a bit unique that way. He never had the abscess that others have had issues with. Literally, we didn't realize he had a vaccine. There was just nothing other than we knew he was producing the antibodies. Unfortunately, and again, his health woes continued. It turns out that December of 2018, he ingested one of his toys, unbeknownst to us. He had destroyed it, and my husband thought he had got all the pieces and thrown them out. But in June, he started having major abdominal issues, not eating. You've got a dog with cancer, you don't know what's going on. Ultrasound was suspicious, but they couldn't really pinpoint what they were seeing. It was more shadows. They didn't know if it was cancer. They didn't know if it was an object. So it was determined, let's treat him for 2 weeks, see if anything improves. If not, re-ultrasound. Second ultrasound, it was clear there was a foreign body. So he had also started limping again during all this time on his other front leg. So we're dealing with all that. We had an amazing IM vet who, at 8.5 months pregnant, spent 2.5 hours on her feet retrieving the toy frog endoscopically, so he didn't have to go through surgery. And then we proceeded to deal with the other limb. And Thabiso's motto, go big or go home. He had a second proximal humerus tumor. Because of the location on the bone, it was determined to be a second primary tumor, not a metastasis. It wasn't in an area where there would have been blood flow to have it be a metastasis, is how it was explained to me, how they determined it to be primary versus a met. And so he went through everything again. Because it was primary, he did the same carboplatin chemo again. They said had it been a metastasis, they would have treated it with different chemo. But because it was considered a primary tumor again, the line of defense was exactly the same. He had stereotactic radiation again. This time the CyberKnife machine was down, and the VCC, which had now changed its name to something else, Dr. Ware, was still there. They now had a linear accelerator. So Dr. Ware did the radiation the second time, and he did it in 2 fractions separated by a day. The first time, the cost of everything he ended up having 2 CTs because we wanted to have the first one, even though we knew we'd have to have a second one when we got there to do the 3D planning, but we didn't want to go all the way through the appointment if it was going to turn out he wasn't eligible. So we had to do 2 CTs and the radiation, and I believe it was around $8,000 total, including the CTs. I can't tell you the second one because Dr. Ware, I still cry thinking about it. He just discounted it extremely. He said that he had the ability to do that in rare cases, and because Thabiso was a rare case, he wanted to do that for us. So we paid very little the second time. I tell people this often. We were going to take out a home equity loan to pay for it. And I'm from a very tiny, small town. And when I went into our local bank, the bank manager said, "Do you mind if I ask why?" And so I explained, and she said, "Oh, tell me all about your cars, please. I can do much better for you." And we ended up refinancing our car to pay for it. And it was painless because we still had car payments. We just extended them for an additional 4 years at the same exact amount. Yeah, it was just the easiest way imaginable to pay for it. Obviously our car didn't get paid off when we had planned, but it was something that was already in our budget. We didn't have to come up with the huge sum all at once. It was just an amazingly easy way to pay for it. And so now we have a second primary tumor. The first one's still doing fantastic. No limp on that leg at all. Really struggling with the other forelimb now, because now he's got cancer in one limb, neuro disease on the back two legs, and now cancer in the other forelimb. This time, the local specialty center where our neurologist was able to get an oncologist on staff. So it was only an hour away. And so we did transfer to her for the medical oncology portion. We still saw Dr. Post occasionally until he left. First Dr. Ettinger left, then Dr. Post left. We did still follow up with him because of the Yale vaccine, but we did the chemo through the more local one. It was just so much easier on Thabiso to not have to travel so extensively. The first time through, he did chemo at the max dosing and didn't miss a beat. The very first chemo, he had nausea for about 12 hours. Other than that, there was nothing. Complete opposite experience the second time around. We ended up eventually going with the lowest dose possible because he just had major issues. And in hindsight, we believe the GI issues he had with the toy that was ingested had created an ulcer. We thought the ulcer had been healed, and in hindsight, we're pretty sure the ulcer was not fully healed. And so that was the reason, because even with metronidazole and metronidazole for the diarrhea, he had Cerenia and ondansetron both for the nausea. Until we added sucralfate, he didn't have any relief. So we're pretty sure that the ulcer was actually the reason that he had so much difficulty with chemo. I always try to put that in there because people get scared about chemo because of how it is with humans, and I always try to explain that even though he had a difficult time the second time, we didn't think it was so much the chemo as it was the unhealed ulcer that caused him to have such difficulty. We debated with our vet team several times whether or not to continue the chemo, and everybody's consensus was, let's keep going. So we did. Again, the radiation worked the same way. By 3 weeks out, he was not limping. He was off pain meds, hunky-dory, got through the chemo. At that point, Dr. Mamula said, we can do a booster if he needs it, but let's check his antibodies. Checked his antibodies. He was still producing antibodies. So we didn't do a booster. And a couple of weeks after he finished chemo, he had a fantastic day, went on one of the longest walks he'd been on in quite a while, because even his neuro disease was cooperating. Next morning, woke up and couldn't get up. The leg had just collapsed. The bone had collapsed on the second tumor, not the first. We don't know if it was related to the radiation. We don't know if it was related to just where the tumor was located, that maybe it was more of a bone destructive tumor than the first one was. Our previous lab had been enrolled in Cornell in the Labrador Health Study and had gone there at the end for necropsy. So we were very familiar with Dr. Castellano at the genome center there. So we contacted her and said, would it be possible to bring him there for necropsy? She agreed that they would very much like to do that. So he did go there for necropsy, thorough necropsy, found 0 signs of metastasis anywhere in his body. Everything clear. The bone was in such bad condition, they agreed that it was likely a primary tumor. They said that the bone was extremely necrotic. And so what they called it was, versus pathological fracture, they called it a bone collapse, and short of amputating his leg, which we couldn't have done because of the same reason, there was nothing we could have done for him. So he woke up that one morning, we got him to our vet to be evaluated, and had to put him down the following morning because we ran out of options. He had turned 12 and a half just a few days before, actually. He was doing so great. He was a registered therapy dog. He did 888 therapy visits. His love was school. He loved the elementary kids like they were all his own. And the treatment we had in 2018 gave him the best year at school he ever had. The kids were amazing, knowing what he was going through. The teacher was amazing. He worked with the entire fourth grade, so he had himself 45 kids that were his. It was just an amazing year, like a bonus year. He was doing well enough following the radiation of the second tumor that in the fall we had started back to therapy visits. We dropped some that required a lot of walking. We got him a cart because of his hind end mobility from the neuro disease, and he rode his cart into school. The week we lost him, he had 3 therapy visits scheduled the following week. That's how well he was doing. My comment to the oncologist, every visit, they say, how's he doing? My comment was always, if we didn't know he had cancer, we would never know he had cancer. I don't know if we were just lucky, if it was just part of him and his personality. I mean, when we adopted him, he had 2 torn CCLs that nobody had noticed because he was so stoic and hid things so well. So whether it was just part of his mental makeup, I don't know. But like I said, day to day, we had no clue that he had cancer once the radiation worked and he lost his limp. Those 3 weeks and the week prior to getting him, so for a month, it was horrendous. I have never seen an animal in pain to that extent. He tried to hide it, but it was there. And he was on hydrocodone, didn't touch the pain. So when people say that they can manage medically, I don't know how. Honestly, maybe in a different location, it's different. But for him, there was no way to manage the pain medically. We didn't know going in what to expect with the stereotactic radiation. We were hopeful it would take away all the pain. And, both times in our experience, it did. To see him go from basically non-weight bearing, other than he has to put it down to move, to having no limp was just utterly amazing. It still amazes me when I look at his videos. He went back. His favorite thing to do was, we called it slaying water bottles. His water bottles were his favorite toy in the world. And during those 4 weeks, he didn't play with water bottles. He barely wanted to eat. Once he felt better, he was back to slaying those water bottles, and he liked to squeeze it until it would pop and then just chew it and crunch it up. And, he would have sometimes a 10 water bottle night, and we'd be like, oh, he's feeling really good today because he's just slaying water bottle after water bottle. And he would bark and demand another one. So that's his long story. And 17 months from when we knew the first tumor was there. The original CT was the first week of July 2018. How long before that the tumor was there, we have no way to say. It was fairly small then, but I'm sure it was there, at least a month or 2 or more before that. And we lost him at the end of November 2019, roughly a year and a half that he lived with the original tumor. And again, other than that 1 month time frame waiting to get diagnosed, to get the appointments, and then for the radiation to fully take effect, we just didn't know. For him to have no metastasis with 2 primary tumors, I mean, I wish there was a way that we could definitively say it was the vaccine. Mark does have his tumor samples. They were able to get samples of both tumors on the necropsy. I think it's just timing wise. I mean, if you think about it, he got his vaccines in April, and we found out he had the tumor the first week of July. So my guess is, again, he didn't have any more CTs in between. He had x-rays, but they weren't x-raying looking for a tumor on the other leg. So some of the x-rays peripherally, the other leg is in there. Everybody looked at them to try to see if they could pick up on, was the tumor there? And the views just weren't in a way that they could tell if it had been there prior. So the thought is that it probably was already there when he got the vaccine, and he didn't start making antibodies until the end of May. So there was only a 1 month time frame from when he started making antibodies to when he was diagnosed with a second primary tumor. So I think the timing was just not there for the vaccine to have prevented that from being worse. Yeah, almost a year later was the second tumor. And then in November of 2019 is when we lost. And I know Mark has done stuff with the tumors and trying to isolate, stuff in relation to the vaccine. I don't know what what he's come up with, or if they were able to come up with anything to definitively say that there was any,
Yeah.
effect from the vaccine on those tumors. I think the vaccine had to have helped prevent the metastasis, though, because
Yes.
it's just pretty unheard of for a dog to have osteo for that long. I was a Peace Corps volunteer in Lesotho in Southern Africa. Thabiso means bringer of joy. And we knew when we adopted him that we wanted to make him into a therapy dog. So the name just suited him. It was the perfect name for him. That was his mission in life, to bring joy everywhere he went. He was the most intuitive being I have ever encountered. Even when he was dealing with the cancer, he would be at the vet. The specialty center near us is also an emergency facility. And so one side is emergency, one side's the specialist. And he was, I had the front end of his help him up harness, and the vet tech had the back end. And we were leaving, and he detoured to somebody. And the vet tech was like, come on, let's go. And I'm like, nope, you have to let him go where he wants to go. And it was somebody waiting on the emergency side that he just sensed needed some comfort. And he chose that moment to go. And the person kind of looked at me like, what's he doing? I was like, just go with the flow. He thinks you need him. Just humor him and pet him. And you could tell the guy did need him. I don't know I didn't ask. He didn't give details. I don't know what was going on with his dog, but everybody in the room is just watching, and you can hear them all talking like, what are we watching here? What did we just witness? And the vet tech was kind of getting a little impatient. And I was like, you have to give him his time. When he's ready, he'll leave, not a second before. And then all of a sudden he just was like, okay, this guy's okay now. I can go. And he just started marching to the door again. And she was like, I really don't understand what I just saw. And I said, you get used to it. He does it everywhere.